Hello Zoe, my name's Dr Martin. What can I do for you today?
I wouldn't usually come to the doctors for just a sore throat, but it's just getting worse.
Oh dear, okay.
Yeah.
How's that? How's it affecting you?
This is like day 2, and it is so painful to swallow.
Yeah.
It feels like my glands are swollen.
Right.
I just can't tell you how painful it is to swallow. My muscles ache, and I've started waking up in the middle of the night because I'm just so hot and sweaty. I just need some help, and I don't know what else to do.
Have you tried taking your temperature to see whether the temperature's raised?
Well, I imagine I'm hot. Well, got a temperature because I'm just so
Feeling
hot.
feverish?
Yeah.
Okay. Have you had any symptoms of a cold or
No,
something
nothing
like
at all.
that?
It's literally my throat, and it's all here.
Have you ever had that problem before?
I don't think I have. No, nothing this bad.
Oh dear.
Yeah.
Well, that does sound really quite unpleasant, so I think we need to have a good look at you and then decide whether you need some treatment for this or not.
Okay.
So should we have a look at you and then make a decision about that?
Yeah, yes, please.
Okay. I've had a good look at your throat and it really does seem quite inflamed. It's swollen and you've got pus on your tonsils as well. And when I've examined your neck, you've got swollen glands. I've checked your temperature and that's quite high. It's 38 degrees C, which is quite unusual. I can't find any symptoms related to a virus or having had a cold. So I think the likelihood is that this is a bacterial infection. We use a scoring system to help us decide whether it's a bacterial infection and therefore whether antibiotics might help you. And in this instance, I think probably using antibiotics is justified. As much as possible, we try to avoid using them. Most infections will just get better on their own, but in this instance, I think it will help to speed up that process.
Yeah. Oh, that's great. Because I've tried all the stuff you can get from the pharmacy,
Yeah.
and then the maximum strength stuff, just not even touching it.
No. Well, it will take a day or two for the antibiotics to start work in terms of helping to get rid of that infection, but you will need to use some painkillers as well, I think. So things like paracetamol, maybe a throat spray, maybe some lozenges to help relieve the discomfort that you're getting would be a good idea. And I'm sure that will help to settle things down. If you do find that your symptoms are getting worse, or if the throat hasn't settled down within a few days, I think we need to have another look at that because we need to make sure that we're getting that treatment right and getting this sorted out for you.
Okay, that's great.
Okay.
Thank you so much.
No problem.